Welcome to my channel. Please subscribe, like, share and press the bell icon to stay connected and notified. Thank you. Part 2 Cervical Spondylosis series. Cervical spondylosis occurs in the cervical spine, the 7 vertebrae which forms the neck region. In this particular video, we'll explore about the anatomy of neck. So let's begin the video. Neck is a complex anatomic region between the head and the body. Neck is the most mobile portion of vertebral column. Understandably, is most vulnerable to wear and tear process and injury. The neck or cervical spine is composed of 7 cervical vertebrae. They are numbered as C1 to 7 in 2 varieties. Atypical vertebrae, that is C1 and C2. Why they call as atypical? Because they look different from rest of the vertebrae. C1, as you can see, just looks like a ring shaped without having much bony projection, and it is called as atlas. C2 called as axis because there is a prominent bony projection which forms an axis with C1. And the other varieties, typical vertebrae, that is C3 to C7, look similar to the other rest of the vertebrae. Atypical vertebrae C1 and C2 together looks like this. C1, the atlas, has no spinous process. It connects the skull to the neck, functions to bear the weight of the skull by providing support, articulates with the occipital condyles of the occiput bone of the skull, forming occipital atlanto joint. The primary motions of the occipital atlanto joint are flexion and extension, responsible for vertical movement of neck. C2, the axis, articulates superiorly with the C1 by the bony structure called the dens or odontoid process. It projects up from the vertebral body and articulates with the C1, that is atlas, and the dens. These dens and the odontoid process permit pivoting motion and allow a greater range of motion in rotating the head laterally. The C2 to C3 junction of the spinal column is important, as this is where flexion and extension occur. What is flexion? Flexion is a movement of the chin towards the chest, and extension is a backward movement of the head. The C3 vertebra is in line with the lower section of the jaw and hyoid bone, which holds the tongue in place. The flexible C3 vertebrae helps aid in the bending and rotation of the neck. C4 vertebra located in close proximity to the thyroid cartilage. C5 vertebra is significant for determining the severity of the neck and spinal injury. C7 vertebra has a distinctive long and prominent spinous process, which is palpable from the skin surface too. Sometimes the 7th cervical vertebra, C7, is associated with an abnormal extra rib known as cervical rib. The primary function of cervical spine is to stabilize and maintain the head in a position that allows our eyes to be parallel to the ground. This function is crucial for the vestibular function, which assists in balance. The structures in the neck are distributed within 4 compartments. Vertebral compartment, which is nothing but having 7 cervical vertebrae, cervical part of spinal canal and spinal cord. The visceral compartment accommodates the trachea, larynx, pharynx, thyroid and parathyroid glands. And third and fourth is nothing but the 2 vascular compartment. Is paired and consists of 2 carotid sheaths on each side of the trachea. Each carotid sheath contains the vagus nerve, common carotid artery and internal jugular vein. Beside these, there are cervical lymph nodes which surrounds the blood vessels. Let's briefly understand about the neck muscles. The musculature of the neck is comprised of a number of different muscle groups. They are divided into anterior neck muscles, lateral or prevertebral neck muscles, posterior neck muscles. Let's talk about the anterior neck muscles. Superficial muscles. What are they? Platysma, sternocleidomastoid, subclavius. Suprahyoid muscles. What are they? Let's see. Digastric muscle, mylohyoid, glenohyoid, stylohyoid. Infrahyoid muscles. Sternohyoid, sternothyroid, thyrohyoid, omohyoid. Scalenus muscles. Anterior scalenus muscles, middle scalenus muscle, posterior. Let's see the lateral neck muscles, prevertebral neck muscles. Rectus capitis, longus capitis, longus colli. And let's see the posterior neck muscles. Superficial posterior neck muscles. Splenius capitis, splenius cervicis. Let's see the suboccipital muscles of posterior part of the neck. Rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis inferior, obliquus capitis superior, transversospinalis muscles, semispinalis capitis, semispinalis cervicis, rotator cervicis, interspinals, intertransversali. To know about the cause, risk factors and symptoms, please watch Part 3 Cervical Spondylosis series.